Before entering patient's room, I will make sure I have all of my supplies with me: inner cannula, neckties, suctioning catheter package, tracheostomy care kit, and my saline solution. Great. And hygiene. Hi there, my name is Steve. I'm your student nurse today. Since you have difficulty speaking, we'll create a method of communication as thumbs up for yes and good, and thumbs down for no and bad. Does that sound good to you? Alright, great, okay. Okay, first of all, I'm gonna take a look at your armband and confirm your name and date of birth with me, okay? Alright, Jimmy James, 1969, October 4. Great, thumbs up, great, alright. I have some questions for you. Before the questions, let me close the Great, for privacy. Okay, so my question is that do you have any allergies, med allergies, or supply allergies, such as chlorhexidine or tape, something like that? No allergies. Okay, great. Do you have any pain? No pain. Awesome. Okay, let me take a look at your vital signs. Okay, so looks like your O2 stats are dropped 89% and your respiratory rate is 28, which is a little bit high. And I see that you're having difficulty breathing, so looks like something's going on. Okay. So I will be listening to your lungs to see that if you have secretions build up in your airway. Is that okay? Alright, good. I'll be going under your gown to listen to the lungs, okay? Alright. Is that okay with you? Great. Hand hygiene, 20 seconds. And putting gloves on. I will alcohol swab my stethoscope just to make sure it's clean and good. Yeah, dry it. It's good. Alright, thumbs up. If I will tell you to breathe in and breathe out. Does this sound good to you? Okay, great. Alright. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Okay, great. Alright. So looks like that there are a lot of secretions in your airway, so we will be cleaning them, okay? Does that sound good? Alright. NIG, 20 seconds. Putting new gloves on. Okay, do you have any questions regarding that? No questions? Okay, great. Alright. I will be cleaning the table for 30 seconds. Just to make sure, be a little bit hard so that all the germs die. How are you doing today? Alright, thumbs up, great, you're doing well. That's good. Alright, good. Okay, so it's gonna air dry for 2 minutes, okay? Great. And I wipe the table for 30 seconds. And hygiene. So basically we're gonna be doing a tracheostomy care, okay, today. Alright, so basically I'll be going in with a suctioning catheter, clean all the secretions and come out, and then the secretion will be cleaned, okay, great. And I will also be replacing the inner cannula and exchange the dressing around the trach area, okay? And also make sure if there are secretions, I would be cleaning them, and I would make sure the skin is intact and dry, no skin impairments. Does that sound good? Great. Okay. And I'll also be exchanging the necktie around your neck, okay? Great. And I'll be keeping a sterile drape over here just for sterility of the inner canal, okay? Does that sound good to you? Do you have any questions? No questions? Great, okay. So I will be doing hand hygiene, and as I see that you're in high tolerance position, that is good for this procedure. And I see that the drapes are closed, so it's good. Alright, so first of all, I'm gonna check your bedside emergency equipment. So looks like you have two trachs, one small and one big. Size 8 is the one you have right now in over there, which is same as that, and I have size 6, which is smaller, just in case if we need a smaller one. I see that you have an extra inner cannula, so that is good. Embu bag, which is oxygen regulator. It's connected to the oxygen source, and let me turn it up to 20 liters, so it is good for 100% oxygen, which is appropriate. Okay. I see that your oxygen collar is connected to appropriate oxygen source, and it's turned up to appropriate oxygen liters. Great. Suction catheter is connected to suction canister, and let me make sure it's turned up to 120, which is right amount of suctioning pressure. Great. Alright, so it is good. And now we'll be exchanging your suctioning catheter, since we do not know when it was exchanged last time. Okay, great. Alright, suctioning catheter is good. I'll be getting my disposable container, sterile container. Inside is sterile of it, so I have to make sure. Great. I'll be removing my gloves. Hand hygiene, 20 seconds. Putting new gloves on. Great. Now I'll be bringing my equipment in. Sterile saline solution and cannula. Necktie. Opening my care kit. Great. So since I do not need sterile gloves, I will be disposing it. And I have my tray kit, the sterile drip. So I'll make sure I do not touch within 1 inch border, and make sure the shiny part is down, so that is good. Great. Okay, so I will be placing my inner cannula into the trach care kit, which is good. Good. Dispose it, and I would pour the saline solution into disposable container and my trach care kit. Great. Good. Alright. Removing my gloves and putting new gloves on by hand hygiene. Alright. So you're still doing okay, right? No discomfort, no super breathing distress, difficulty breathing. It's still difficult breathing, but not really bad, right? Okay, great. Okay, so basically I'll be hyperoxygenating you, okay? Alright. Moving the oxygen cap. So I will be waiting 6 seconds between the breaths I give you, just to make sure it's not too much, okay? Great. And I will be securing the faceplate. Great. Giving you just a couple breaths. 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6. Alright, 3 breaths are in, and I see that your O2 stats have also came up, which is great, to 99%. So this is basically to give you enough oxygen to go through the procedure well enough. Okay, does this sound good? How did you feel? You feel great? Okay, great. So now I'll be suctioning you, but prior to suctioning I will be making sure testing my suctioning catheter. Great. So looks like it is working, and while suctioning I need to cover my cap of the suctioning catheter. Okay, so I'll be going in, and it could make you cough, so that's okay. So it's gonna be pretty quick. I will just ask you to hold your breath for 30 seconds. That's okay, right? Great. Alright. Let me first keep it on top. Alright. Great. Okay. Great. Looks like all the secretions are out. So do you feel like you need another sectioning? No? No another sectioning? That's good. Um, okay. So how do you feel? I see that you're breathing okay, and also your vital signs have got better. Your O2 saturations have gone to 89%. Also, I see that your respiratory rate is 18, okay? So that is also great. And I see that you're breathing okay, which is great. How did you feel? And you said you do not need another sectioning, right? That's good. Alright. And I would make sure that I wait 30 seconds if I need to re-section you, okay? While re-sectioning if there are still secretions left, okay? And since your O2 stats are up, I don't need to hyperoxygenate you again, okay? Great. Alright. 30 seconds 20 seconds hand hygiene. I have my gloves on. Good. Okay. So now it's time to replace your inner canal, okay? Still breathing okay, right? Great. Removing the oxygen source. Securing faceplate. And it could make you cough, so just be with me, okay? Great. 1, 2, 3, ready. Good. Good, good. Making sure the sterile inner canal doesn't touch anything. Great. So it looks like you tolerated the procedure well. And now I will be removing the gauze. And skin assessment, looks like the skin is gray, dry and intact, no redness, no inflammation. That is good. Also see that there are some secretions over there, so I'm gonna clean and put a new gauze over there. I also see that necktie is moist, which we'll be replacing that. Okay. All right. Putting the oxygen cap on. Great. All right. Hand hygiene. Gloves. 20 seconds. Hand hygiene, 20 seconds, and putting on gloves. Alright, so I'm gonna soak my Q-tips and have 3 gauze soaked in water, soaked in saline solution. Great. Great, great. Alright. Okay, so I'll be cleaning my patient now. You're still breathing okay, right? Great. Okay. Move the oxygen source and get my Q-tip in. No discomfort, right? Great. Alright. Q-tip bottom swipe. Good. Securing faceplate. Top part swipe. Good. Bottom part swipe. Good. Top part swipe. Good. Faceplate swipe. Great. Now I need to air dry it. Oh, pat dry it with the dry skin and the faceplate. Great. Alright, looks like it's clean now and also dry. So I'll put new gauze in, okay? Great. Securing the faceplate, making sure nothing gets messed up. Are you still breathing okay? Great. Alright. Great. Put the oxygen cap back on. I still see that your O2 stats and everything is, vitals are good. And also I see that you tolerated the procedure well. And our gauze is well back on, so there's no problem. Everything looks good, and you said you feel great breathing, right? Good breathing? Okay, no difficulty breathing? Great. I'm gonna remove my gloves and hand hygiene. And now I'll be bringing my co-worker in to exchange the necktie, okay, since it's moist. Okay, great. Alright. Okay, thank you. Hand hygiene for 20 seconds. I'm putting gloves on. Hey Jimmy, I brought my nursing co-worker with me. His name is John.
My name is John. I did my hand hygiene for 20 seconds and I got my gloves on.
Great. So we'll be replacing your necktie. As it looks moist, we definitely need to replace it. Getting my new necktie and disposing its packaging. Great. Alright, so let's replace it, okay? Great. Removing the oxygen source. John, can you please secure the faceplate? Great. Removing the old faceplate, necktie. Alright, putting the new one in. Great, by looking, I will slid it to John under the pillow, and I see no abnormalities when I was looking at the skin. Skin looks no redness, no inflammation, nothing like that. Also, trach looks fine too. There is no crackness in the trach, and the dressing looks clean and well. Great. With 2 finger spacing. Great, 2 finger spacing is great. Alright. Alright. Thank goodness. Okay, so I'll be putting oxygen cap on. Great. And by looking at your vital signs, your oxygen stats are 98% and respiratory rate is 16, which is great. Also, I see that you're breathing well, which is also great. You agree with me? Great. Do you have any pain going on? No pain? Great. Do you have any questions and concerns for me? No? Great. And I saw that you tolerated the procedure really well. That's true. Do you agree with me? That's great. Alright. Okay, so I'll be listening to your lungs right now with my stethoscope. That's okay with you, right? Okay, great. Alright. And I will also be lowering your gown down just to listen it well. Okay, is that okay with you? Great. Great. I'll clean my stethoscope with alcohol swab just for sanitization and dry it. Great. Alright, breathe in, breathe out, thumbs up. Great. Breathe in, breathe out. Breathe in, breathe out. Great. Looks like there are minimal secretions in your airway, so that is great. And you have no breathing difficulty, that is also great. Okay. Alright, I will be disposing all of my procedure supplies. Great. Do you have any questions and concerns? You're still breathing okay, right? Great. Alright. And hygiene, and I make sure that bed is in lowest position. Two wheels are up, and you have your call bell. Please call me if any abnormalities is observed by you. Okay, great, thank you. I will be out of the patient's room by hand hygiene and time to documentation. So I will document date and time of the procedure, how procedure was tolerated by the patient, which is well and good. Also skin assessment, which is no abnormalities, no redness, nothing like that. Also trach has no cracks, no abnormalities, that's great too. Dressing, everything looks clean and well. Also patient has no pain. Vital signs are normal, which is 98 as oxygen stat and respiratory rate as 16. And also I assessed the lung sounds, which is also great, equal and clear bilaterally. Sputum is clear and thick, which is great. Thank you.